Okay, good morning, Dr. Anthony, and thank you for joining us for this edition of the COVID-19 update. Let's begin with some numbers this morning. Where do we stand with the number of COVID-19 cases to date?
So right now we have about 277 active cases across Guyana. What we have noticed is that we're getting more cases in Region 4. So right now we have 166 cases in Region 4. We have approximately 55 cases in Region 6. And in Region 3, we have 27 cases. Region 2, there are about 11 cases. But the trend over the last 3-4 days have been an increase in cases. Over the last 24 hours, we would have had 36 new cases, having done more than 1,000 tests. So we have noticed for the last 4 or 5 days an upward trend of new cases, and we have to be vigilant about that. We have about 6 persons who are in the ICU. 4 of those persons are intubated. So this is also a new feature that we have seen with these new cases that we're getting. And I think because we have such close contact with the US and other countries, that eventually we would have those cases coming here as well. So maybe the new, this increase in cases is perhaps being fueled by a BA2 subvariant. We are, of course, going to be monitoring this, and we are going to send some of these samples to do the genetic sequencing to determine exactly which type of variant we have circulating in Guyana. We have also noted that about a month ago, the emergence of other variants, subvariants of the Omicron, and that is a subvariant called BA4 and BA5, that again was discovered in South Africa, but it's now in different countries. That too is more transmissible than the original Omicron strain, so it's much more transmissible. So that's something that we are also watching. So far, while these new subvariants are more transmissible, we still see that a lot of people are having mild symptoms, but we are also seeing a few persons who would have had underlying disease. They are getting more severe symptoms and going into the hospital. We have seen this in other countries, and we have now, with the increase in cases, we have also seen a few people coming into the hospital. So again, we have to keep monitoring that. So in 1974, we had passed a law in Guyana to ensure that children are vaccinated. And at that time, in the law, children required at least 6 types of vaccines. Now, since then, things have evolved, and we are giving many more vaccines than is covered by the law. And people have accepted this because these vaccines help children. So we were able to afford more. We have expanded the vaccination regimen. But what had happened from 74 to now, we didn't change the law to to accommodate what we were doing. And so recently we signed that order because the minister can make the order. So having gotten the cabinet's agreement, I was then able to make the order to expand the disease that are covered in the 1974 Act from 6 diseases to now 16 diseases. And we are already doing the vaccination, so it's nothing new. It's just making sure that we are compliant with the law. So we have updated the law, and we'll continue our regular vaccination program.